Hello and welcome back to Everywhere Medical. Today we are going to be talking about various hormones that are circulating your body and regulating a ton of different processes that you might not really think about. So this concept is really difficult to grasp sometimes when you don't have the big picture, and I wanted to provide this information in a cohesive format so it's a lot easier to put together and learn for good instead of memorizing things and forgetting them. So to start off, we're going to talk about the posterior pituitary, which is located on the posterior part of the pituitary. So the first hormone that's secreted is oxytocin. Oxytocin is a big player in something like childbirth when the female reproductive system is going through a positive feedback loop. Oxytocin is used to actually give birth, and it's a really cool thing that you can look into. But we have a lot of hormones to cover today. So next one up is ADH, which is anti-diuretic hormone. Diuretic means to excrete. So if it's an anti-diuretic hormone, that means it's not going to allow you to secrete, which is used in practical ways. Like if you're dehydrated, you're not going to use the bathroom as much because you need to conserve that fluid. But there are two disorders that are involved with this as well. So SIADH, and that's going to give you a very, very low urine output and also a low sodium concentration. And then there's also diabetes insipidus, which would give you the opposite. So a high urine output and also a high sodium concentration. And this is due inversely because you're having a very low anti-diuretic hormone is causing a high urinary output because you don't have anti-diuretic hormone. So you're just losing all of this water, and that's causing your sodium concentration to skyrocket. And on the other side, if you have a very high ADH secretion that's abnormal, you're going to have a really, really low urine output, and that dilution is going to cause your sodium to be low. So that can be an issue because your sodium needs to be maintained at 135 to 145 in order to be healthy. So moving on, we're going to move to another condition and different hormones that are affecting your body in the anterior pituitary. So to start off, we have thyroid stimulating hormone. Pretty easy. It stimulates the thyroid. So I'm just going to draw an arrow for now, and we'll explain it in a little bit. You have growth hormone. And growth hormone is just in charge of growth. Not too hard. You do need to monitor for excess growth hormone because it can lead to conditions like acromegaly, giganticism, and really affect kids usually in puberty, but it can happen as an adult as well. So next up we have ACTH, which is Adrenocorticotropic Hormone, and that is actually going to be stimulating your adrenals on your kidney, which in turn secrete another hormone called cortisol, which is the stress hormone. So if you're feeling really stressed out about your exams, you're going to have really high cortisol. And that's because you have high ACTH, which is stimulating that. Next up, we have something called follicle stimulating hormone, which is going to secrete estrogen, which is another hormone that has to that involves the female reproductive system. It is involved in the males as well, but not as heavily. So moving on, we are going to talk about the thyroid. Like we said before, the thyroid stimulating hormone in the anterior pituitary, it stimulates the thyroid, which actually will stimulate these two hormones, T3 and T4. Now, the stimulation of T3 and T4 actually is a normal thing. It keeps your metabolism going and keeps that in balance, but whenever that gets out of balance and your metabolism is thrown off, you can have hyperthyroidism or hypothyroidism. Now, hyperthyroidism is when it's really high levels of T3 and T4, which is going to cause a low weight. You're going to see patients really thirsty. They're going to be really hot, not able to cool down, and they can also have a goiter, which is a big lump on your neck, which your thyroid is very enlarged. So with hypothyroidism, you're going to have a high weight, so the exact opposite. These patients are going to be really, they're going to have something called myxedema, MYX edema, which you should probably Google because the photo of that will really help you remember what it is, but it's kind of like a rash. Next, you are going to have a goiter is actually possible with this, but it's due to a different cause, which would be decreased iodine. So with hyperthyroidism, it can actually get more severe, leading to a thyroid storm. So if you have way too much of that T3 and T4, you can have a thyroid storm, which causes a whole host of things, and it's very, very dangerous. It'll give you really high blood pressure, a fever, a high heart rate, and that needs to be treated immediately. So one way we can treat that is actually with iodine and a host of other things, but it's important to monitor that in your patients. So next up with the thyroid, we have calcitonin, which is in charge of calcium. And calcium, actually, with calcitonin, is moved from your bloodstream into your bones. So it's going to be moving all the calcium in your blood to your bones, which in turn causes low blood calcium. Parathyroid hormone, PTH, does the exact opposite. So it's going to cast out that calcium and bring it into the blood. So these two things are a delicate balance, and they are always working with each other and against each other in order to give you the perfect blood calcium level, which is 8.6 to 10.3. And that's important to remember. Both of these electrolytes are very important just because that balance is crucial for your body. So lastly, we're going to talk about cortisol, which is that stress hormone, and it can be associated with other conditions. Cortisol is a corticosteroid, so it can equate to two different things. One of them is Cushing's, which is a very, very high cortisol, and Addison's disease, which is the other, which is a very low cortisol. So Cushing's, you're going to see symptoms like moon face, which is a very swollen face, and then angioedema, which would be swollen lips. Again, that's swelling. And with Addison's, a very hyperpigmented face. So they're going to look like they have a really bronze tan. John F. Kennedy actually had Addison's, so he always had this glowing tan, but it was actually his disease. And you're also going to have hypotension. You're going to feel really fatigued and tired all the time. And in order to remember this, I always think addisons, you need to add more cortisol. So cortisol needs to be added to addisons to make them better again. So just an overview, these are all the hormones that are involved with metabolism and regulating a lot of the functions in your body.